I think the meeting has gone very well. We have a record number of abstracts that were submitted this year. Approximately 9,000 and 8,200 were accepted. The attendance is close to what it's been in the past, around 30,000, with about 3,000 that are virtually meeting with us, and the remaining 27,000 that are here in person. And I think we've had a great variety of topics that have been discussed, including the importance of being inclusive in clinical trials and also in the research that we do, and emphasizing the importance of science in medical advances and curing patients. And so new therapies have been discussed, clinical trials, and also novel findings in understanding how blood cells develop and mature. Some of the studies were one on the unique differences in mutational profiles in diffuse large B-cell lymphoma in African Americans as opposed to other populations, and what should we do in terms of treating African Americans with DLBCL or diffuse large B-cell lymphoma. And there are a lot of questions as to whether they're more advanced when they present, accessibility to therapy. And then also we have had a number of presentations on what we call classical hematology, which is previously known as benign hematology, but it's anything but benign. And so there have been novel findings that have been presented on the use of bispecific antibodies in the setting of immunological disorders such as lupus. And then for malignant hematology, there have been a number of novel agents that are being discussed. And so we're developing a better understanding of blood cell development, the vascular endothelium. And I believe that the number of individuals that are in training appear to be increased to me. I don't know what the final tally is, but I think it's really important to make sure that we recruit and retain individuals in hematology. So we've been very focused on doing that and providing awards. And this year, ASH actually increased the number of awards by increasing the funding to $20 million. And so we feel that's really important to keep our science moving ahead, because without doing research and science, we don't make medical advances or cure more diseases and save lives. So that's been a very important factor in making sure that we have funding to be able to continue research. So I believe that in the next 5 years, we will have even more novel immunological therapies. The advent of CAR T cells has been very interesting. We've learned so much more about the immune system that we did not understand previously. And a lot of it's going to be even applicable to non-hematologic disorders. So we are making, again, great advances. Hematologists have really been pioneers in medicine, understanding hematopoiesis, spatial transcription, and just cellular biology. So I see that knowledge foundation continuing to increase over the next 5 years. Mm-hmm. And by better understanding the marrow microenvironment and looking at that in addition to malignant cells, in the case of malignant hematology, that has become important. A focus that we've had in the past has really been only on the malignant cells, but we now understand more that the microenvironment or the surrounding cells around the malignant cells are also playing a role. And so I see that becoming another major factor in how we develop and design clinical trials.